Hello and welcome everyone to this presentation on how to select answerable questions for research. I am your host Cecilia Dunn. So let's get started everyone. The purpose of this presentation is to give you an overview of the introduction on evidence-based practices and why we use them to generate research. 2, we'll go over the key components and considerations of evidence-based practices such as evidence-based steps to take and how to begin a search. 3 is an overview of how we begin to brainstorm ideas and narrow down one search, as well as where an individual might find evidence-based studies. 4, my example in building a study that can help students to see how applying the steps can help to create the right research questions. In this slideshow, there are 2 clinical vignettes that give an overview of a fictional case, and it includes answered questions. Lastly is the summary and references used in the slideshow. So let's take a look at the introduction. Okay, so what is evidence-based practice? Evidence-based practice uses current research on a subject. Professionals in the mental health field look for researchable evidence which has been attained from studies that have already been conducted. Why should students use evidence-based practices, you might ask? Because to conduct clinical research would mean that we could possibly cause harm to clients. It takes a certain amount of funding and approval from certain agencies. Finding information that has already been researched helps students and researchers to look at the evidence obtained in the past as well as examine existing knowledge of research. Therapists may examine literature which pertains to a specific therapeutic modality, treatment, clinical practices, as well as patients' biopsychosocial characteristics and circumstances. Okay, so if we're looking at the components and considerations of evidence-based practice, step 1, a therapist must search for information that they need in order to create a researchable question. Step 2 is to attain information which encompasses the best evidence that can be used to answer a therapist's question. Step 3 is to look at the literature, and it must be reviewed for validity, credibility, and relevancy in research methods that reflect literature that the authors have used. Step 4, they take what knowledge they have found and incorporate it in what they want to ask by examining clinical practices and clinical appraisal to find the most fitting practices for patients or clinical settings. Step 5 involves examining the methods of treatment applied and evaluating for effectiveness. Let's look at one step, which includes locating the right information and putting it into answerable questions. Firstly, it is imperative for students to identify the subject that they are most interested in. Choosing a subject helps students to have the ability to research specific problems and examine the efficacy of certain theories and/or treatments. Locate the most imperative keywords that you're going to use. An example could be like borderline personality disorder, depression, attachment, the attachment theory. As an example, as you are examining these topics, you should think about what interests you about your key topics and why they matter to you. Topics must be narrowed down by adding additional keywords that can be researched. As an example, if I'm interested in borderline personality disorder, I may want to know how borderline personality disorder affects adolescent age youth, and I may be interested in learning about what treatments are currently used for adolescent youth with borderline personality disorder. I also would like to know more about narcissism personality disorder and how it affects adults and their relationships in the medical field, as well as examine what treatments that are most effective for narcissistic personality disorder. After deciding upon one or more topics, it's important that you begin researching your topics. As you are narrowing down your search, you will want to be very specific with the variables you choose. Where to find current articles. Students looking to generate ideas should seek out more than one or two research ideas. You should allow yourself to write out many ideas as possible when generating ideas. You will narrow your search down, and when you have all the ideas in front of you, if you are still having trouble narrowing down your topics, you can use a standardized format that will help you formulate questions that can be searched and successfully answered. It's a system called PICOT. P-I-C-O-T. It's a first letter mnemonic, which stands for 1. Population, in determining the population that you will study. 2. In determining your issue of interest. 3. In how does it compare with existing data on the subject. 4. In deciding what your final outcome will be in research. And 5. What is the time frame that you have? Do you have just a month to do this? Do you have 2 weeks? Or do you have like a whole year? It's important to define your purpose by asking yourself the following questions. What treatment is effective for specific disorders or the therapeutic modality you have chosen? How can family and friends and mental health professionals help clients with specific issues? What is the risk of not receiving treatment and prognosis? What is the assessment process of this specific disorder or condition? And lastly, we will be looking at the description of how a certain disorder affects someone. So select where you will find information such as from your university library, public libraries, places like online archives, or European Research Library journals, even journal articles, that are available online through databases such as PubMed or PsycInfo, to name a few. So I am adding this slide to demonstrate how I had chosen to research how many adolescent age female teens between the ages of 15 to 20 are diagnosed with borderline personality disorder in the United States. I then wanted to ask, how does this compare with young men diagnosed with borderline personality disorder? I am hoping to find in my research what are the differences in diagnosis and why. What helped the adolescent females the most in treatment efficient with adolescents? Let's take a look at this first vignette that describes a young girl named Whitney Carver. She's 17 years old, white female who was referred to a mental health clinic by her school counselor. The high school counselor felt that Whitney seemed to present several symptoms of borderline personality disorder. Whitney lives with her mother, her stepfather, and a younger sibling. Whitney is a senior in high school. She is captain of her swim team, and also she's involved in her cross-country running team. Academically, Whitney has always done really well, but she has not been able to keep up with her work because of her emotional state. Whitney has reported having intense, unstable moods where one minute she's okay, but something like a bad grade can trigger her emotions and she'll become enraged or really depressed. She also has reported having impulsive behaviors such as drinking too much at parties, exercising until exhaustion, or scratching herself. Whitney has reported that in the past she has tried to kill herself once when she was 13 and recently after a breakup with her boyfriend. Whitney tries to put on a happy, positive front in front of her peers and coaches. Whitney says she worries all the time that she is going to lose friends, and she feels abandoned when she's alone. Sometimes the feelings of abandonment and emptiness feel so intense that she has anxiety attacks. Family history. Whitney does not know if there is a family history of mental illness, but states that she was diagnosed with anxiety at the age of 12. She had also been molested when she was 5 by an uncle. Her parents divorced when she was 8 years old. Whitney's stepfather and mother quickly got married, and her mother paid little attention to Whitney's needs, while her father moved out of state. Let's go over the questions in the next slide. Okay, so what were answerable questions that were in the vignette 1? Firstly, I put what percent of females with borderline personality disorder also had a mood disorder or reported being diagnosed with an anxiety disorder? The answer says women between ages 15 and 20, had a 92 to 96% chance of having an anxiety disorder or a mood disorder. Who has been found to have the highest rate of borderline personality disorder? Well, females have a rate that is actually three times higher than men. How does borderline personality disorder differ in females and males? Well, women internalize their emotions more, so it's more internal conflict, as where men, it's more of an external symptom. What is the best treatment options for adolescent females with borderline personality disorder? Dialectical behavioral therapy or cognitive therapy? Looking at behavioral, the dialectical behavioral therapy specifically, it says that it was created to help people with borderline personality disorder, but it also helps, with an array of conditions. It specifically helps clients to learn how to regulate their emotions and to reduce behaviors that are destructive, while the cognitive behavioral therapy can help clients to look within themselves and to identify what their internal dialogue is, as well as change core beliefs that the client has had. Lastly, what are some ways that therapists can test for borderline personality disorder? Let's take a look at the second vignette. This is about a man named Jim Sharp. He's 47 years old, white, male, who has been asked to attend therapy sessions because of his bullying behaviors in the workplace, which Jim has agreed to in order to keep his position in the hospital. Jim is divorced and has no children currently. Jim lives alone. Jim states that he is an anesthesiologist at the hospital he works at. Jim speaks highly of his importance in his position, his exceptional skills and intelligence that placed him ahead of his class in college and with other anesthesiologists. And others have made complaints. There are concerns about Jim's behavior. Jim has lashed out at other colleagues and patients in his care for over several months. Jim states that this happens because other people, like the anesthesiologist assistants, are not competent in their positions, and he feels that he does not get the admiration he deserves from colleagues as well as patients. Jim got divorced about 3 years ago and admitted to working extra shifts and staying as busy as possible. Jim states that there is some mental illness that runs in his family. His mother suffered from major depressive disorder, and Jim states that from time to time he feels depressed. Jim was raised by his mother and father and has 2 older brothers. Jim admits to needing some help because he would like to eventually form another intimate relationship, either just a friend or a life partner. The treatment proposed is a 10-stage process of therapy, where 1, the therapist will focus on what symptoms or situation they want to find relief in. 2, to learn about what their triggers are, and to help clients like Jim to formulate a plan to avoid painful situations and continue to get to know Jim. The stage 3, the therapist will focus on learning more about Jim and his childhood, and learn about how Jim learned to cope with stressful situations in his life. 4, creating new ways to help Jim cope, and informing new habits such as finding ways to find true happiness. And then in stage 7, we will look at what has been discussed and learned. Step 8 is to learn to know and to change the internal voice. How we speak to ourselves, what we say to ourselves, has such a profound impact in our lives, and it's imperative to explore ways to help Jim change that inner dialogue. 9, to learn to empathize with others by expanding one's emotional empathy. This, of course, is going to be a slow start and focus on people around him who may have things in common with Jim. 10, step 10 is time to drop one's defenses. We hope that Jim would drop his defenses and let go of the internal dialogue that separates him from others, so that Jim can learn to be authentic with others. Answerable questions about Vignette 2. Which doctors in the medical field had the highest rate of narcissism in the United States? Studies showed that surgeons had the highest rate of narcissism at 22%. What was the best treatment for narcissistic personality disorder, specifically in men like Jim? There are many approaches to treatment. However, in this case, we used a 10-stage process to approach the changing process for Jim. The point of using the 10-stage approach is to help build rapport with the client and to bring the therapy in slowly, in a relaxed pace for the client, This allows the client to feel that they are in control without judgment or confrontation. It is imperative as students and professionals in the mental health field to have an understanding of how to select the right research questions. Evidence-based practices are crucial for finding the right and most effective research studies that have been conducted in the past. Research questions should contain more than one subject of interest and must be narrowed down to a precise objective you will focus on. In this slideshow, I have provided an example by using borderline personality disorder and the subject of narcissism found in medical professionals. I also provided clinical vignettes for 2 cases with the answerable questions. I want to thank you for taking a part in this presentation. And I am your host, Cecilia Dunn. Thanks for watching. Bye-bye for now.